We're here from Groundswell to share our experience of what works for us when rolling out the COVID-19 vaccinations at your service. We know sometimes it's hard to understand people's views or actions, but we're going to share what works for us. This is based on our roles working within the homeless healthcare teams to deliver the vaccine and our own personal experiences of homelessness.
We've all had the vaccine. I find it useful to tell people this when they are being offered the vaccine. Together we're slowing the spread of the virus, preventing serious illness and saving lives. That's worth a sore arm for a couple of days.
At the time I was homeless, I had so much to deal with. I didn't really care about looking after myself. But right now, it's not just about me. I need to protect others around me, special people, my daughter, my colleagues, the people I actually work with, my friends. So that's why I had the vaccination. At first, I was extremely anxious and frightened to have this vaccination because it is a new thing. And it wasn't until I talked to my local GP and found out the benefits of having this vaccination, and I decided to have it. And I'm really glad I did.
Groundswell has created 2 short Q&A guides answering questions about the vaccine and what to do after you've had the vaccine. This includes information on how the vaccine was developed and how it works. All the questions came from people experiencing homelessness. Familiarise yourself with the Q&A, and sometimes it's easier to talk things through than expect people to read lots of information.
If the vaccine is coming to your service, having a random person knock at your door in a hostel or being told the vaccine is here now does not work. It should be pre-planned.
Think about what time the vaccine is happening. When are most people likely to be around? It's also helpful for the service to ensure that there is a COVID-safe space for the health team and that the paperwork is completed in advance. Think about the best way to communicate this practical information with your residents. Are there languages or other accessibility needs that need to be considered?
If the vaccine team can come to the service before vaccination day, this allows people to ask questions. If there are any medical questions, it's advisable to ask one of the nurses on hand. Having time to let people read information, ask questions, and speak to people they trust, like peer workers. Try to make sure the health team can give time. Rushing things can be unsettling.
If health teams aren't available to come to your setting, make sure people are registered with a GP. Everyone has a right to register and access a GP. They don't need a fixed address or ID, and their immigration status does not matter. Make sure the surgery has up-to-date contact information for the client and for you as their support worker, so they can be called when the vaccine is ready for them.
We've all had the COVID-19 vaccine and are still following the government's restrictions to prevent serious illness and save lives. Because we want a future where we can connect with the people we care about and ensure people can access the support they need safely.